Welcome back to Living 808. The Vein and Skin Center of Hawaii is helping us all to be more aware of vein health and treatment.
Yeah, so much to know about vein care, and Dr. Chung has the technology and the expertise. Vein and Skin Center of Hawaii, just off of Kapiolani Boulevard. We're joined now by Dr. Chung. Dr. Chung, thank you so much for being with us on Living 808. Vein health, very important.
Yes, it's regarding, it's more of a health issue now. A lot of patients don't understand that it is something that can be a medical cause. Everybody has veins.
Okay, well, you know what? We'll try to get back to that a little later. But instead, let's just go ahead and go to break, and we'll come back with much, much more.
Right. It's National Breast Cancer Awareness Month. Dr. Pang from the Cancer Center of Hawaii joins us to tell us about a new facility that is helping treat patients and the types of services provided there.
So that's coming up a little bit later, and then instead we're going to go back to the Vein and Skin Center of Hawaii. Vein and Skin Center of Hawaii, just off of Kapiolani Boulevard. We're joined now by Dr. Chung. Dr. Chung, thank you so much for being with us on Living 808. Vein health, very important.
Yes, it's regarding, it's more of a health issue now. A lot of patients don't understand that it is something that can be a medical cause. Everybody has veins on their legs, but then when they start noticing more bulging veins, or they start seeing spider veins, or most importantly, they all come in complaining of pain in their legs. And that's one of the tip-offs of that it might be something medically related.
Okay, so you threw out a couple of different veins. You said spider veins, you said varicose veins. What are varicose veins?
Well, varicose veins are just dilated veins that are due to disease circulation in the legs. And so it's abnormal. And so what happens is that blood is not circulating back to your heart very well, and it can cause some detriment to how your legs feel. They can feel heavy, they can cramp, they can ache. But most importantly is that as long-term neglect of this condition can result in having skin ulcers develop, and then causing inability to effectively ambulate or walk, you know, just your daily chores at home.
So you can see varicose veins. I know that a lot of times they're bulging and
Yes.
different colors in your legs. How do you treat something like that, especially if they can cause problems?
So what we first do is obviously the patient comes in for a consultation. After consultation, after we discuss what might be the cause for this, we then decide whether or not we need to do an ultrasound. The ultrasound will show us how circulation is in the veins. After I do the ultrasound, then we kind of formulate a plan on what is needed to correct this abnormal circulation. And it can range from just simple injection, which is called sclerotherapy, or we can do a procedure called endovenous laser ablation, which is I place a laser inside the diseased vein under ultrasound, and we pretty much get rid of it that way. And it's like rerouting the plumbing, and so it allows more efficient circulation afterwards. And then for the bulging veins, cosmetically, we can also remove and to make it more appealing after, and also to help with the flow as well.
So great points for treatment. How would somebody know about vein care? Like, what is important about knowing about the vein care?
That's a good question. I mean, most importantly, I would say a majority of my patients come in because they do see visible veins, but most importantly is that they have pain in their legs. Their legs just don't feel normal, especially if they've been sitting for a long time. Then they start feeling like, my legs don't feel good. They're also swelling, or I keep on having to prop my legs up to try to get some comfort, but it just keeps on getting worse. And that's what usually patients come in because their legs just don't feel normal anymore.
I'm really happy with the results. No more leg cramps at night, as well as no visible varicose veins in the back of my legs. I liked it because everything was done here at the doctor's office. It didn't take more than an hour to hour 15 minutes for the whole procedure. Doctor was very calming. He walked me through the whole thing, talked to me throughout the whole procedure. So I would recommend it to anybody that really needs it, because I did it and it was fine.
Okay, so I know we're in your office.
Yes.
Somebody starts to see the vein, starts to feel the pain
Yes.
from the vein. How do they choose a doctor, and what are they looking for in choosing a doctor?
Well, I would say most importantly is we do get referrals from primary care doctors, but most importantly is, go to our website, take a look at our credentials. I would say that doctors that are focused just on veins, that have passed the exam, the board exam for vein specialty, is probably the most, important thing to look at. And the fact that I would say that, who does the ultrasound in the office? Is it the physician or is it a technician? For our case, I do all my ultrasounds for the last 10 years, and so I know exactly what I'm treating, and it's, case by case.
Dr. Chung, Vein and Skin Center of Hawaii, thank you so much for being with us on
Thank you.
Living in 08. Great information.
Thank you.
So some of the video might be a little graphic, but we want everybody to know what it entails. We
Right.
want people to see what you have to go through.
And I think a lot of patients say it's worth it because if you see the before and after, amazing difference.
Really amazing, because some of the pictures that showed the bulging early on, and that can be really painful.
Yeah.
All right, well, coming up a little later, the Department of Health wants you to choose Healthy Now, the initiative